Could prednisone actually help prevent osteoporosis? That's crazy because everybody knows that the number one side effect to prednisone is osteoporosis, right? At least that's what they taught me on all my pharmacy school exams. Hi, I'm Dr. Megan, your prednisone pharmacist, and I have some interesting research to share with you today about what prednisone really does as far as osteoporosis. So I'm going to be speaking from a study published by Frank Buttgereit, and it's called Views on Glucocorticoid Therapy in Rheumatology, the Age of Convergence. So what he suggests is that there are actually a lot of factors that contribute to osteoporosis, and taking prednisone and other steroids or glucocorticoids might be a double-edged sword. It might be helpful and it might be harmful at the same time in causing worsening or helping osteoporosis. So let me share with you a few of his words. So the most important thing to understand, the baseline foundation that we have to build everything I'm about to say on, is that we need to use as much glucocorticoid, that's his word, I'm just going to say prednisone when he says glucocorticoid, as much prednisone as necessary, but as little as possible should be used over time and in number of doses, number of milligrams. If we can keep that foundation, then the rest of this will make more sense. So because of that, we're going to find out that bone fragility, or the ability to break the osteoporosis, isn't solely determined by the dose and duration of prednisone. But how could that be? So let me jump to later on in his article where he talks about the 4 most concerning side effects. And he says they're the most troubling glucocorticoid-related adverse effects for both patients and physicians. So people were surveyed, doctors and patients were surveyed. What are the worst side effects of prednisone? What are the most troubling to you? First of all, bone loss, the osteoporosis. Second, hyperglycemia, which is a fancy word for high blood sugar, which, if untreated and out of control, leads to diabetes. So basically, osteoporosis and diabetes. Then cardiovascular disease, that's heart disease. And then finally, infection. So all 4 of those are the most concerning adverse effects of prednisone. And we're going to focus today on just the osteoporosis. So because of this, it's really tricky to give black and white answers about something that's true for everyone. People are taking prednisone for anything from what I have, which was a bleeding disorder that showed up on my skin, to rheumatoid arthritis. And rheumatological conditions are in the joints. And then vasculitis, those are the blood vessels like PMR, which is polymyalgia rheumatica, and giant cell arteritis. So those 3 conditions, I'm just going to call them RA, PMR, and GCA, are 3 of the conditions where people tend to use prednisone for a long time, and it's worth it. It makes sense to continue taking it, and we can do all that we can to prevent the osteoporosis. So what factors are there in the osteoporosis? Let me get to the right part of his article. So he says that there are different types of people who get osteoporosis. And there are preventative factors, good things that prevent osteoporosis. And then there are risk factors that make it more likely that you're going to get osteoporosis. And we want to keep this tilted into the let's not get osteoporosis. So we want to tilt it this way so that we're preventing the osteoporosis instead of tilting this way, which is leading to more risks for osteoporosis. Okay. So first, I guess I'll talk about the risks, and then I'll talk about the preventative factors. So things that increase your risk for osteoporosis include taking prednisone, right? Because it has what he calls deleterious effects on bone, which essentially means it's sucking nutrients. It's withdrawing withdrawing calcium, vitamin D, magnesium, vitamin K2, sucking those from your system and not letting your bones use them to be strong. So that is a problem. So just remember that glucocorticoids like prednisone are number one. Number two, inflammatory disease activity. So if you have an untreated inflammatory disease, that's a problem. So if you have rheumatoid arthritis or PMR or GCA or any other condition with a lot of inflammation and it's not treated, that it has a problem on the bone itself. An untreated condition having rampant inflammation, that inflammation alone really hurts your bones because that inflammation is doing the same thing. It's withdrawing those vital nutrients. It's stealing from Peter to pay Paul. It's using the strength of your bones to keep you alive, to cope with all that inflammation. So having an untreated condition is a problem, which is going to explain one of the preventive factors in a minute. Increasing age. The older you are, the more likely your bone loss is going to be greater. Postmenopausal women are the highest risk for osteoporosis. And it's just the older you are, the less bone strength you had to begin with. And so losing a certain amount is a higher percentage of your total bone mass that you already had to begin with. And so that is a higher risk than if you're in your 30s like me. Your risk of osteoporosis is a lot smaller from taking the prednisone. Next is lack of hormones. So hormones like estrogen, progesterone, these things are vital for men, testosterone, even for women. Having the right amount of testosterone is important for bone strength. Lack of these hormones is a problem. And if they're missing, for whatever reason, they need to be replenished. So if you've already gone through menopause, then you have less hormones. And that's kind of one of the reasons that leads to the osteoporosis. But you don't necessarily have to replenish it unless for your age, you are low. So you can do tests. You can do a spit test or a blood test. Spit tests usually work better to find out your hormone status. Then serological factors. So that's blood tests. Like if you have rheumatoid arthritis and you have certain factors that show up when you get your blood test, like the ACPA in rheumatoid arthritis. And then other medications can worsen your osteoporosis risk, like proton pump inhibitors or Prilosec, Protonix, Nexium, that type of medication, which is also omeprazole, esomeprazole, Nexium, and then Protonix, pantoprazole. All of those medications can lower your bone density. And then genetic factors. If your grandma had osteoporosis, you're more likely to have osteoporosis. That's just how it works. My grandma had osteoporosis, so I'm a little scared. So that's the risk factors. Then here are preventative factors, things that are in your benefit, things make it so you're less likely to get osteoporosis. Glucocorticoids like prednisone. What? I thought you said that was a risk factor. Yes, I did. It is a risk factor and it is a preventative factor. That's the crazy part. Prednisone is two sides of the same, like when it does good things, it also does bad things, right? And so it increases your risk for osteoporosis, but it also is protective. And how could that be? Because it is an anti-inflammatory. I told you one of the risk factors was having out of control inflammation. You take the prednisone, your inflammation is under control. So it's causing osteoporosis, but it's helping prevent it at the same time, right? That's prednisone for you. Then if we have treated the underlying disease, that means less inflammation. That is preventative for preventing osteoporosis. Treatment of the osteoporosis itself. There are lots of treatments for osteoporosis. That's a totally another thing we'll have to cover in another topic video. If that's interesting to you, let me know below. Regular weight-bearing exercise is protective. Good nutrition, which includes sufficient intake of protein, calcium, and vitamin D. And then if the nutrition intake using food isn't enough, supplementation with calcium and vitamin D is recommended, and that's protective for osteoporosis, which is why in the supplement I created, Nutranize Zone, I have calcium, vitamin D, magnesium, potassium, vitamin K2, all of the good things you need to build strong bones. And then the final preventative factor to protect you from getting osteoporosis is avoidance of tobacco and alcohol. I know. I'm sorry. People always want to tell me that you can drink alcohol while on prednisone, and I'm like, no, you can't. Not unless you want adrenal problems and bone problems. So preventing alcohol abuse, preventing tobacco abuse, those are protective from they prevent osteoporosis. So when you find a way to help the risk factors go less and the preventive factors get heavier, then you're tilting the benefits to risks scale in your favor. That means you have a way to take prednisone, because it's on both sides of the scale, right? To take prednisone and have it be worth it for you. That you are tilting that scale into your favor, doing more of this and less of this, right? That's why I recommend Nutranize Zone. It tilts that scale into your favor. It instead of having more risks, it tilts it so that you're in the benefit side, that you can get more of the goodness of prednisone and less of the risks. He said, glucocorticoid use features prominently as both a risk factor and a preventative factor. That is so true. And so his conclusion, and it is mine too, that in this current age, there is broad agreement that prednisone is a valuable drug that needs to be handled with great care. We should never just prescribe it willy-nilly, right? It should only be prescribed in special situations. Back to his words. Where necessary, prednisone should be used, but the use of every milligram, every single one, especially over long periods of time, must always be questioned and justified. Talk to your doctor about it. Is it completely justified? If you're on 20 milligrams, could you be on 17 and a half? Just justify every single milligram. A dose should not be continued without questioning whether it is possible to reduce it further. Always ask, could we possibly reduce this further to lessen my exposure over time? Because every single milligram increases your risk for osteoporosis and those other 4 side effects of concern. So if you found this helpful, I recommend following the advice of the experts who prescribe prednisone the most, getting the protection you need, doing all you can to tilt this scale into your favor. I have my supplement and it does that. And there are other resources I'd love to share with you. Just like this. I thank you for liking this. And then go to nutranize.com. Get the supplement you need to tilt the scale into your favor so that every milligram you take has been put into the right perspective, that you're doing all that you can to minimize your risks and feel like yourself again while on prednisone. Signing off is Dr. Megan, your prednisone pharmacist.